And this is how Terry initially appeared on the left prior to any treatments about 10 years ago. And you can see the areas of concern, the lack of definition on the jawline and some of the fullness on the neck. We performed a treatment known as Thermage, radiofrequency skin tightening at that time. And you can see what her result was following that treatment, which was a long-term result. Notice the enhanced definition of the jawline and much more refined neck angle. I think it's maybe even better seen on this oblique view. Compare her preoperative treatment photo on the left, where there's very little definition to the jawline, some fullness of the jowls. And on her post-treatment oblique, you can see how that whole area has been cleaned up with much better definition of the chin and of the neck angle. So thinking back to those days, what was your experience with the Thermage treatment?
During the treatment or after?
Both, actually.
Well, during the treatment, I remember it was a little bit of a painful experience, but the result afterward was always worth it for me because I always had immediate results, and they were exactly the results I was looking for. 10
years later, we now have a dramatic advance in the non-surgical skin tightening arena of Thermage, their latest generation technology called Thermage CPT, with CPT standing for Comfort Pulse Technology. And I think from a patient perspective, and we'll let Terry be the judge of this, but what it offers is a more rapid, more efficient treatment. It's more comfortable during the treatment, and I feel it offers much enhanced results compared to the standard Thermage, which was already a good technology. She had this treatment grid applied, which is a grid that has specific dimensions that's going to serve as the roadmap for the remainder of the treatment. So what we're going to do is calibrate the system to her comfort level. Now, previous to the procedure, Terry was given 1 Percocet and 1 milligram of Ativan. So you can see she's still wide awake, she's conversant, she's aware of what's going on, but yet she's a little bit comfortable. So that's the perfect level of an awareness that we like for this type of procedure. So let's get started. Have a coupling fluid. My assistant Lori is just applying a coupling fluid to the skin surface. Now this fluid is crucial because it's going to create a union between the tip and her skin so that there's no intermediary between the two areas, and so it can effectively transmit the radio frequency energy. If you look carefully at this device, there's a tip that has a variety of different squares within this 3 centimeter squared grid, and this has a feedback mechanism that prevents any skin damage and enhances safety. So what happens is this won't deliver the pulse until it's safe to do so, and the machine has a feedback mechanism. I'm putting a little tension on the skin too to enhance the penetration. Okay, so that was 8 pulses. How do you rate the intensity of the pulses?
It was fairly comfortable.
And this radio frequency is penetrating through the full thickness of the skin and dermis. It heats the collagen, and then as the collagen reforms, it shortens and tightens. And that's what gives the visible skin tightening effect. From beneath her jaw on both sides, you can see how much more laxity there is on the skin in my left hand compared to in the right hand. See that difference in the amount of elasticity? We've now moved to the other side, and I'm going to be applying the same pattern of pulses and the same amount of pulses, so we get precisely identical amount of energy on both sides to get a symmetric skin tightening effect. After each Thermage treatment, the benefits of Thermage continue up to about 4 to 6 months. So I would never repeat Thermage in that interval, but generally anytime after about 6 months, once you've achieved the maximum skin tightening, it's quite appropriate to repeat the procedure anytime thereafter. So first of all, Terry, how was the experience?
It was better than the last one.
Okay, so compared to the old generation of Thermage,
Yes.
It was more comfortable?
Yes, it was more comfortable. I didn't cry. I didn't have any tears.
Excellent. And did you feel that dialing in the vibrational setting towards the end made a difference?
Yes.
Afterwards, the post-treatment recommendations are to avoid any anti-inflammatories such as ibuprofen, aspirin, and to avoid the application of ice. And why is that? Because there's a certain inflammatory process that occurs with the collagen denaturing or separation and the reannealing or retightening process. That can be somewhat impeded by anti-inflammatories, so we encourage patients to avoid that, which usually isn't a problem because there's really no necessary post-op pain management regimen. No antibiotics are required. We generally follow up with our patients for the first time about a month after the procedure, and keep in mind that the improvements are ongoing with further tightening that occurs up to 4 to 6 months post-treatment.